Hi, everyone. Thanks for joining us for our Member Assistance Program Informational Webinar. We're going to give folks a moment to log in. As we're waiting, if folks want to say hi in the chat box with your name and organization and where you're joining us from, that would be great. We are recording this and we will post the slides as well as the recording on our Member Assistance Program webpage, so you can access that at a later time if needed. All right. Well, welcome again, everyone. Thanks so much for joining us. I'm joined today by my colleague Monica, who will be helping to keep an eye on the chat box and letting people in throughout the call today. If you do have any questions throughout the call, feel free to either hold them till the end where we'll have some time for Q&A and you can unmute and ask your questions over audio, or you can also post them in the chat box and we'll work to address those as we're able to throughout the call. I'm also joined by Will Brown with All One Health. Will is our account manager at All One Health and will be helping me share some content throughout the call today and answering any questions that you might have. So again, if you're just joining us, feel free to say hi in the chat with your organization and where you're joining us from. My name is Rachel Bruns, and I'm the Chief Engagement Officer for America's Service Commissions. And I will be kind of jumping right in to give a little bit of an overview first on what the Member Assistance Program is. For those of you that aren't familiar with us, America's Service Commissions, also known as ASK, is the National Association for the 52 governor-designated state service commissions. We also provide training and technical assistance to AmeriCorps programs, and we offer and facilitate the Member Assistance Program. We facilitated and started facilitating the Member Assistance Program around 7 years ago and really started offering this after hearing for several years around the challenges that many AmeriCorps programs are facing and finding affordable and quality mental health care services for their AmeriCorps members. So have been really pleased that we've been able to facilitate this service and helping to increase access to mental health resources to the broader national service field. Just for your awareness, we do have a new strategic plan that we launched earlier this year that covers a 3-year period. So if you're interested, you can read more about this on our website. But what I would say is one thing that we really have as a goal for us is really working to support the broader national service ecosystem. So part of our work in advancing the member assistance program really helps us to meet our third goal of our strategic plan, as well as goal 1 in building capacity for our network as well. As I mentioned before, the real intent behind launching the AmeriCorps Member Assistance Program, or MAP as we refer to it, was really with the goal to improve access to quality mental health services to AmeriCorps members, as well as kind of a secondary benefit is employees of AmeriCorps programs as well. In order to access the program, a MAP program, programs need to be members of ASK, and you can enroll for either your AmeriCorps members and your staff of AmeriCorps programs, or one or the other. So primarily the majority of programs enroll for their AmeriCorps members, but we do have a mix of programs that also enroll for their employees as well. We also see some other organizations in our broader field that enroll and access the program as well. Just a high-level overview, we have not made any changes for the program from a cost perspective or benefit perspective for the next program year. So this basic package is the same as it has been for those of you that are familiar with it. The same baseline cost, which is $350 for the kind of partner membership fee, and then $5 per member for the access to the program as a whole and the basic package. And we'll talk more specifically about what all of these look like. The only difference between packages is premium package includes 3 face-to-face or virtual counseling sessions, and then the Premium Plus package has 6 face-to-face or virtual counseling sessions. And the price difference is $10 for the premium package and $15 per member for the Premium Plus. And again, we're going to go into more details about what each of these look like and what they offer in just a moment. So really the core of that program of what we're offering is the telephonic mental health counseling. This is the piece that provides access to members wherever they're located across the country 24/7. All they need is to have access to a phone to make those phone calls to request in the moment unlimited mental health support. And this is available to them and their household members. For this and all of the programs that we offer through this program, they are being provided through our partner at All One Health, who is helping to facilitate access to these services. There is access to translation services, as well as important to note that participation is voluntary and confidential as well. So with that, I'm going to go ahead and invite Will Brown from All One Health to join me to talk a little bit more specifically about all of the different benefits available to the program, and then I'll come back to talk about how to enroll and other information that might be helpful to folks. So Will, can I turn it over to you to talk a little bit more about the telephonic mental health counseling?
Yes, good morning. Thank you very much for inviting me. And I'm going to add in the chat that you can also access the services through our member portal. And I'm going to put this in here it's allonehealtheap.com. It's like a home page for EAP, but we do call it a member portal. And then when you sign up, you need to use AmeriCorps as the organization code to get in and create your own account. And it's like any of the other sites where you have to put in your email and then you'll have a password and you can save it and you can just go in. And the advantage here, all right, so I just pushed send it. It's through the chat now. The advantage here is that you can start the process with online request forms. You can chat with us and get things going here. But the slide that's in front of you here is that you're going to have licensed mental health professionals to speak to at any time of the day. And it could be a crisis. It could be something mundane. Something just came up for me and I want to bounce this off you. So it's for all the packages, we have that in the moment support for telephone counseling. You don't always need an appointment. Sometimes it's just right then and there you want to talk with somebody, and that's the advantage here. Next slide, please. As Rachel was describing, there are options here. I think who would have thought when I first started in my career, telehealth was a thing, but it has become post-COVID more of a norm, where people are comfortable, it's convenient. So not only do you have the telehealth, but if you have a preference to see somebody, there is that face-to-face support for the premium, and it is the 3 sessions for premium, and then we've got the premium plus with the 6 sessions. So, it gets people started. Sometimes you just don't know who to turn to, and that's what we're helping you do, is find somebody that's going to be there for you. And we have a whole connecting team, and this is what we manage tightly here. So you again can contact us with the 800 number. You can do these online request forms. If you went out to the allonehealtheap.com, you'll see these online request forms for counseling or the other services. We offer more than just the counseling that we're going to look at in a minute. Now, the in-person might take you a little bit longer, but probably not going to take you 2 to 4 weeks. But we want to pad that because people are pretty full with these days. But again, this is our business, so we're going to make this work for you and do everything we can to make it more promptly than that 2 to 4 week window. Next slide. Then we have life coaching for all the programs. So it's 3 sessions of life coaching for the basic, for the premium plus. And what's the difference between counseling and coaching? Well, coaching is more present, future oriented. Not that counseling doesn't have that emphasis, to think about your future, but we're not going to do any kind of history taking. What is your goal? and looking at the plan to get there and keeping you accountable. So these are certified life coaches, and that might fit you better than counseling. And again, this is available to anybody you live with. So if it's available to you as an employee of AmeriCorps or a member, it's any of the household members that has access to all of these resources. Next slide, please. We need attorneys in our life, and we'll get you started. We'll look at what the specialty is and make that referral. So I tell the story. I was in Denver traveling, and I got a parking ticket, and I wasn't sure if I had to pay it, but of course I needed to pay for it. But I got that answer quickly through accessing the resource here. Next slide, please. Financial consultation. This is in-house, so we're not looking to sell you any products. We're just looking to provide education, good, sound consultation about whatever it is that you might want help with. So maybe you're looking at retiring soon and you want to consult with us about what are the optics here of what your financial situation is. And it's helpful. I've used it, when we were looking at purchasing a home and looking at our budget and what kind of mortgage could we carry. And so just being able to bounce something off. They'll do some work with you. It's up to 3 sessions. And maybe they'll be like, okay, well, let's schedule a follow-up. Why don't you send me some of the documents so that I can take a look at them, and we'll have another conversation. So that is available to you. Next slide, please. Personal assistant. So, who couldn't use a personal assistant? So we're going to take a look at what are the schedules if you're planning a trip and you're wanting to look at the transportation system in that city from getting from A to B. They'll dig deep into whatever it is. So maybe you're looking to find a yoga class on Saturday mornings and you want help to do that. Pet care, maybe, we have a crazy Shih Tzu. He is a little Shih Tzu. So we take him to the groomer and he's aggressive as heck. So to find that groomer was like, yeah, it took a long time. So this is the work that we do, and we'll follow up and make sure you got what you needed. Next slide, please. Work-life resources, maybe it's a list of childcare providers that provide in-home care. We'll get you started. People that are licensed with the state, and this is online, but we'll work that for you. Maybe it's summer camp. Here we are, and summer is beckoning here. A few more days. So it's similar to personal assistant. You would then do the work of looking at what those education programs are, the adoption resources, elder care, needs that we have. So just think of it more broadly around, hey, maybe MAP can help with these resources. Next slide, please. Medical advocacy. Let me give you a couple of examples here. So we have a medical social worker. My wife had a dental, she had something done by the dentist, a crown, and she thought that it should have been paid for. So she involved the medical advocate to look into it for her. And that is, healthcare is complex. So getting somebody that they're accustomed to doing this work of, getting information, looking at the plans. It's not just about insurance. It could be maybe you're trying to move your mom from, a assisted living to skilled nursing facility, and you have siblings and you're not sure who should do what and the timing, and there could be legal related questions or maybe, legal maybe some some procedural I didn't mean to say legal, but there could be legal questions, but there could be procedural questions. I know that happened with my mom in terms of transitioning her, and we were able to take advantage of the medical advocacy resource. So it could be varied, in all of these kinds of things. So think about it again in a broad manner. Next slide, please. So we've got some orientations. We've got sort of a protocol here, Rachel, that maybe you take this one. We've got orientate like what we're doing now. Whenever we get in front of folks, we're going to be able to make an impression on what these resources are all about. Give you some examples, like I did, and personalize this. So we like to offer these orientations.
Yeah, thanks, Will. Before I move into this slide a little bit more, there is a question in the chat, Will, that I thought we could address now from Candace about can All One Health support members getting weight loss coverage or weight loss prescriptions? I don't believe so, but wanted to let you address that.
I mean, we could look into what those resources are. We don't have a direct line necessarily, but we definitely, I know they've done things like that where, okay, here's what's offered here in your area. So yeah, don't, you know, think of it as resource referrals, but we're going to dig to find what those resources are. Again, it takes time to look into that. And these are folks that do this every day. So they've got good skills to do that. Oh, and by the way, I don't think I mentioned how many times you can use this benefit. It's per situation. Okay, so let's say this month you're feeling stressed from work, and then in a few months you can contact us again and do some, maybe you want to do work with the same person, and that's fine. It's not like once per year. You only have access to it. It's per situation.
Thanks, Will. And so on kind of some of these additional resources, kind of this is a little bit more targeted towards you as the program or commission that's signing up, but we host virtual orientations for your members. And we really target a lot of those in the fall, kind of late summer, August, September, October, and those are recorded. But basically, those are spaces that we send you the link. You can share those with your members so that they can join and listen to learn more about the benefits and how to access these benefits. We also have been hosting them in the spring as well. We did a couple orientations this spring. But just know that's something that we schedule out and as a space for you to invite members to these kind of pre-existing orientation sessions. We also are available as kind of as requesting and pending availability for us to join you for any orientations that you have with your members. So we often get requests for us to join kind of one of your scheduled orientations with members, and we'll join in for 20, 30 minutes to walk through these benefits and answer any questions that folks might have about accessing the services. And then All One Health does a number of trainings. It has a training catalog. So some of you have benefited from taking advantage of bringing on someone from the All One Health training team to provide training to your members on a wide range of topics around, personal wellness, around stress management, lots of different topics that are available. So if this is something that you're interested, if you are enrolled in MAP, you can reach out to us and we can help support you in accessing a discounted rate for that training. And they can then incorporate talking about accessing the member assistance program as well as part of that. And then we
I was,
do, oh, go ahead, Will.
I
Yeah.
was just going to add, when you go to allonehealtheap.com, peruse it a bit because you're going to see webinars that have been recorded. We offer two a month, and there's a library there. So there's a lot of articles. There's newsletters. It's a wealth of information. So keep that in mind. Definitely can schedule something with us, and we can customize it. But you do they have access to the live to the training catalog somewhere on? Okay. So there's a host of different trainings, and just know that there are pre-recorded ones. Anybody can watch them.
Thanks, Will. And the
I think you just
link.
answered this. Sorry.
Yeah, no, you're good, Candace. So, yes, I mean you can all log into the website and access those recordings and webinars. The thing I was going to mention is that the training catalog. So when you actually enroll for the program, we then send you a welcome message kind of close to the start date that you select, which includes several information and links. So, how to access the training catalog, the form to submit these types of requests to us, and that kind of helps us facilitate contact with All One Health on any requests like a training, like an orientation, or if you want All One Health to help facilitate like a crisis debrief. Those are all things that are available, but there is an additional cost for the
And
unique.
Rachel, say a little bit about what that crisis debrief would look like. I mean, what the context of what those are for.
Yeah. So we've seen programs have a crisis debrief for your members in situations like maybe in your local community there was a school shooting, for example. Maybe your members are serving at a school, whether it was at their school or another one, providing space for members to debrief. So that would be one example of things that we have seen programs do. We've also had situations where someone died or passed away at the program, whether it was a staff member, another member, providing space for people to come together and grieve that situation. This is kind of a nice opportunity to have a trained facilitator come in and provide that facilitation for you through the member assistance program, and then also sharing more about how individuals can get additional support as needed through MAP. Anything else on that, Will? But those are a couple
No, thank,
examples I would say
yeah,
that are
no, thanks. I mean,
probably
it
most
really,
common.
yeah,
Yeah. Hmm.
yeah, no, but I mean, I think you want to have this at the ready because these things happen out there. It, it, you want to being prepared psychologically and just having that kind of access is it's probably some of the most important work that we do actually is meeting people at the hour of need when something like that happens that destabilizes a work group. Let us know how we can help.
So these are, again, just some additional things that are available as folks may need them throughout the program year. And then as an AmeriCorps program that is a member of Ask, this is kind of separate from the member assistance program, but as you are joining Ask to access and enroll in the program, you also have access to a base camp group for AmeriCorps state programs where you can ask questions of each other and share information and really just kind of connect and hopefully get insights from others on different topics. We also host a number of webinars for AmeriCorps programs. We have a quarterly webinar series as well as a kind of summer program management series, and those are really focused on program management topics. And then a couple other kind of things is you can post on our job board as well as nominate for our award program. So moving a little bit towards enrollment, and then we'll open it up for any further questions that folks may have. We do have the enrollment links live on our website, which is linked here in the slides. And maybe Monica, you can post the web page and the link in a moment when you have a moment to do that. But you'll find that there are two separate enrollment links, and so probably the hardest part is just knowing which one to use so that you're signing up on the right form. If you are a state commission that is enrolling your portfolio, then there is a form for commissions. If you are a program that is enrolling your program, your commission is not enrolling you, then you would complete the enrollment yourself under the program form. If you're not sure if your commission is enrolling you or not, then we encourage you to check in with your state commission program officer so they can let you know whether you should enroll directly or if you should hold and the commission will enroll on your behalf. We have some deadlines that we ask folks to abide by to help us manage our enrollment process, as well as in our processes working with All One Health to make sure everyone gets access in a timely manner. If your program has a July 1 start date, which really there probably are very few programs in the next coming program year that will be in a position with that, unless you're a VISTA program, we ask you to enroll by June 20th. I think the vast majority of programs will be in the second one in the second or third bullets here, which is if you have an August 1 or September 1 start date. For August, we ask you to enroll by July 24th. And for September, we ask you to enroll by August 20th. And that helps us ensure by the time you enroll, we then will send you your welcome message kind of between the date that you enroll and that start date so that you can then share the necessary information with your members on how to get access to services. I will also note that we do take late enrollments. However, we kind of have September 1 as the latest start date, and we do not prorate back for any late enrollments. Those are all the slides here. And if you do have questions for us at any time, whether it's about benefits, whether it's about enrollment, you can email us at the map@statecommissions.org email, and we will get back to you as soon as we can. We also know that folks have lots of questions, especially as it relates to program management and how that intersects with the member assistance program, if you can charge certain costs for MAP to your grants. All of those are answered in our FAQs, which are also available on our webpage as well. So I'm going to pause there. I know we went through a large amount of information, but want to see what questions folks have for us at this time.
Did you catch the one on as a program staff member, can we access?
Um, so Candace, you can definitely access the website that Will shared and review kind of the information there. If your program wants to enroll your employees, you can enroll employees. And on the enrollment form, you can say how many members you're enrolling and then how many employees that you are enrolling. So you can technically enroll employees and access all the same benefits as your members as well.
Oh, yeah, no, I was just asking because sometimes the members are like, they're in a crisis in their life, or maybe it feels like a crisis to them, and just going to the portal can feel difficult. So sometimes it'd be helpful for me to kind of know what it looks like when you go in there and how to navigate it. So I don't know if you guys have any screenshots of like what it looks like in there that you could share in the future. That would, just so I can kind of guide and support.
Yeah, I'll just pull it up on the screen here. I usually walk people through this as part of our orientations with members. And so what I would just say is that the most important thing is to encourage members to call the 1-800 number. That's the quickest way to get connected to services. So if members are needing that in the moment telephonic mental health support, they shouldn't be bothering with the portal. They should be calling the 1-800 number and saying, I need to speak with a counselor in the moment. And so that's the best way to get services. If they want to ask for, if you have premium or premium plus for that in person or virtual, they can also call 1-800 number. But there is also a form on the website that they can use to request services as well. Um,
They're
so
right there. They're the ones that are in the black, the mental health counseling and the work life. So if you click one of those, it's just you fill out some information and then we get back to you.
Yep. I think I needed, I'll log in here, but show you what the website actually looks like here once you log in. And basically, as Will was talking about, there's a lot of information on a variety of topics that you can explore. There are webinars. You can go to upcoming events and register for any topics that are of interest, or you can find recorded webinars on a variety of topics. But if you are looking at this on your phone, it's a mobile friendly website. If you click this, it will call the 1-800 number for you. And then those same forms that were on that landing page are also here to request services. And then this chat support is talking to like an intake person. So if you have questions on accessing benefits, you can talk to somebody to ask questions about services, but just know that that is limited to kind of business hours, is my understanding in terms of asking questions about benefits.
Mhm.
Yes.
And the telephone therapy is limited by a certain number. I know that there was a number for the face-to-face, but what about the telephone? counseling?
Yeah, so for the basic model, they're going to do that in the moment work with you and right then and there. So that's the basic model. The premium is up to 3 sessions, whether it's face to face or telephone, or video virtual. Then the 6 session is the premium plus. So that's this up to 6 sessions per situation that is available.
And so, Candace, just to confirm, for the 24/7 telephonic mental health counseling, that's unlimited. They can
Right,
call
for anything.
as they
Yeah,
want. Mhm.
yeah. Right, right. If you have the, thank you. If you have the premium or the premium plus, you can still talk right then and there 24/7 about what's going on. It's just that you could schedule an appointment with the premium and the premium plus up to 3, up to 6, respectively.
Yep. And then, Anna, in terms of enrolling members, so if you do have more members, um, I would just say if it's like significantly more, then you should reach out to us. Generally speaking, I know with slot conversions that it's not necessarily the case, but we want to make sure that we have you covered for the number of individuals enrolled at that point in time. So, say you enroll for 20 members. At any given time throughout the year, you might have 10 members maybe serving in the fall, and then 5 members serving in the spring, and then maybe you have 10 members serving in the summer. We want to make sure you have, you have it. If you have 20 members enrolled, we want to make sure you have 20 covered in the program. So hopefully that makes sense, but you can always reach out to us and ask questions based on if your program has any shifts mid-program year. Any other questions? All right. I know there's a lot going on right now. So if folks do have questions outside of the call, again, don't hesitate to reach out to us at map@statecommissions.org. Encourage you all to mark your calendars with the respective deadline for your enrollment. I know for, again, most of you, you will be looking at probably that July or August deadline. We will post the recording and slides from this call to our webpage so you can access that or share that with other folks that missed the call today if needed. Thanks everyone for joining us, and I hope you have a great rest of your day. Bye, everyone.
Thank you.